3 seconds, we'll be able to hear you.
I believe we are just missing.
Get some earphones just in case. Is that okay or not? I can't hear you.
Yeah,
That's better.
Okay, I shut my door. Okay.
I think that was it. Yeah. No, it seems to be fine.
Do we have everyone yet?
we're missing Chuck. The only person.
Kathy, I'm not sure if that's you, but we're still getting a little bit of that noise again. You want to try one more time?
We have Chuck now.
It's not me, I was
So I
muted.
think we'll have everybody.
Somewhere. Here you are, Chuck. We have everybody.
Good morning, everyone, and thanks to all of you for being here today. That sound okay? Okay. Thank you, Superintendent Spearman, for joining us here today. I know the South Carolina General Assembly is returning next week to consider the appropriation of the CARES Act funding, and I know you've been working with them on securing funding for continuous learning for our students this summer and for the reopening of our schools. Yeah, our last meeting last Thursday, we adopted draft recommendations for the reopening of schools this fall and posted them on Monday for public comment. We have continued to review these recommendations and have received input through the Accelerated Ed website and from stakeholder groups. I want to thank all of those again for taking your time to email us and express your thoughts. To the task force, your input has been invaluable to us through this process. We have also met with or received information from various groups that have been instrumental in helping us formulate these recommendations, such as school improvement councils, the PTA, several arts groups, school librarians, children's advocacy groups, the South Carolina School Board Association and teacher groups, and we really appreciate, just to name a few, there have been many that have assisted us. I also know that our task force members and State Department staff have reviewed many of the recommendations being proposed by other states as well and have drawn on that information. I want to especially recognize our advisory groups that have worked with our subcommittees and brought a tremendous amount of expertise to the process. I also want to thank the State Department staff for their hard work in assisting our subcommittees and providing information to the task force. Now, I'd like to note that also that we have several groups that are represented on our task force, South Carolina School Boards Association, the Palmetto State Teachers Association, SCASA is represented, also the South Carolina Education Association. I also like to note that many of our task force members are also parents and grandparents of children in public school. So I just wanted to make note that we have worked very hard to make sure that we have reached every group or heard from as many groups as possible in making these recommendations. I would like to note also that very few states have been as transparent as we have in this process by having public meetings and receiving public comment. And while it may have taken us a little longer in the process, I know Superintendent Spearman and this task force that that has been an essential component of formulating these recommendations. Now, on just a personal note, I also want to recognize that today is Juneteenth, which is a significant day in this country's history. And I'd just like to recognize Shonda Jefferson to make a few comments.
Thank you, Kathy. It is with great pride that I take a moment to publicly recognize the significance of this day, Juneteenth, which commemorates the ending of slavery in the United States of America. On this day in 1865, General Gordon Granger arrived with Union soldiers in Galveston, Texas, and announced to enslaved African Americans that the Civil War had ended and they were free. His announcement came more than 2 years after President Abraham Lincoln signed the Emancipation Proclamation. Juneteenth is a special day for African Americans and serves as a critical inflection point in the Black freedom struggle. Today is a day that we celebrate freedom and reflect on the many contributions of African Americans in this country. Given the current climate around issues of racial injustice, inequality, and inequities, it is evident that there is much more work to do. As we look toward the future and finalize our recommendations for the school year, let's all work together to dismantle systemic racism by changing policies and practices within our schools, offices, businesses, and society that are unjust, oppressive, and debarring. Happy Juneteenth, and thank you.
I would also, I want to recognize Superintendent Spearman. Superintendent Spearman, thank you again for all your hard work in this process. And now I would like for you to update us and make some comments. Thank you.
Thank you, Dr. Coleman, and happy Juneteenth. Shonda, thank you so much for those remarks. It's another happy Independence Day, just like even more so than July 4th. So thank you for reminding us of the importance of this very special day. And thank you to all the folks who are tuned in listening for the wonderful public comments. We've gotten over 500 responses from the public and associations groups. Kathy mentioned some of those, a couple that were not mentioned: the Carolina Family Engagement Center, Eat Smart, Move More, the Alliance for Healthy Generation, Public Education Partners in Greenville, SCEA, PSTA, SC for Ed, the Southern Education Foundation, and the Superintendent's Affiliate of SCASA, as well as she mentioned the School Boards Association. So thank you to all. Some really strong comments that will influence us, as I'm sure you'll make these final decisions today, and certainly will influence me as I work to implement this plan across the state. One of the comments that I heard over and over is that we need more specifics. We need more details with our DHEC partners, as school district superintendents and officials will have to make some very, very important decisions. I want you to know that we are in constant communication with DHEC. They have done they're partners with us and supporters. They want to see us get back in school as soon as possible, but as safely as possible. So we are continuing to work with them over the weekend, through the next few weeks, to get those details on protocols that superintendents will need. They recently provided us with protocols to follow when a student or staff member tests positive for COVID-19, and they're committed to working with us to establish that low, medium, high spread protocols for school operations. We heard you loud and clear, and we agree, as do they. And we are working with them to give you that information that you will need and supply that for you in the next few days, and certainly by so that you'll have it in time to make the decisions that you will need. They'll also establish some thresholds for us, similar to the flu, when schools should consider changing operations or close temporarily. They underline again, and you've heard Dr. Bell, Dr. Traxler, the governor talk about this, and you'll hear me talking about it more as well. If we want to keep schools open, if we want to get back to a more normal life, we have to maintain social distancing and we have to wear masks when we're out in public. You will see that DHEC and the Department of Education will set an expectation for mask wearing among school communities. Will it be required for all? No, because there are some folks, some children who should not wear masks, but certainly we need to press on our faculty and our parents that one way to hold down the spread is to wear masks. So we are working with DHEC on that language and hope that the public will support us in trying to be as careful as possible by wearing masks. So I look forward to your discussion today. We will be setting up a meeting for our school district officials with our healthcare folks in the next few weeks for them to be able to ask those individual questions that they need. Again, that was another recommendation that came through from some of our superintendents. That is in the works as we speak, and we'll be making those announcements. So again, while the report will be, the larger part of it will be completed today, there are some parts of it that are fluid, and we will continue to add details and offer resources to all of our education folks as we go through the rest of the summer. So thank you very much. I appreciate the support that the legislature is giving us in funding from the CARES Act availability. We'll know more details in the final vote on that this upcoming week, but I really appreciate the support that they've given us. They're being very generous, and we will use that funding very wisely to impact student achievement and student social and emotional support. So thank you very much.
Thank you, Superintendent Spearman. Next, as I mentioned, we received a tremendous amount of feedback, and we certainly appreciate that. And again, I believe our task force subcommittees met approximately 25 times. So we've been working very diligently over the last several weeks. And so now I would like to ask Ryan Brown, who is the Communications Director for the State Department of Education, to share with us some of the summary information that we received on our educator feedback. Ryan?
Thank you, Dr. Coleman. As Superintendent Spearman mentioned, we have received considerable feedback throughout this process, and particularly with the draft report that was released earlier this week. To date, and I haven't gone through the ones this morning, but we've received close to 600 emailed responses from parents, teachers, and members of the public. That brings our total throughout this process since the first meeting to over 2,000 emailed public comments. That, of course, is not including those that we've received through direct email to task force members or through social media. We asked associations and organizations throughout the state that have an interest in education to provide feedback on this report, just like we did for the summer report. And I'm going to read through the full list of names from those that we received formal feedback from in alphabetical order. That's the Alliance for a Healthier Generation, Eat Smart, Move More, Palmetto State Teachers Association, Public Education Partners Greenville, SC for Ed, South Carolina Association of School Administrators, Superintendents Affiliate, South Carolina Education Association, South Carolina School Boards Association, South Carolina School Improvement Council, and the Carolina Family Engagement Center, and the Southern Education Foundation. All of those were provided to the task force members. The department staff went through all of the emails that I mentioned, compiled them, provided those to the task force members, and also provided those that were particularly substantive and dealt with particular recommendations to the subcommittee chairs so that they could discuss them with their members for modification in the final report.
Thank you, Ryan. Any questions for Ryan? We appreciate you providing that information. Next on our agenda, we're going to move right on into the discussion of our guidance and recommendations for the 2021 school year, the feedback we received. So I'd like for each subcommittee to give an overview of any changes that they are recommending from their continued review and from the feedback received. Then if any task force members has any questions or comments, we'll certainly take those and make it note of any changes that are agreed on by the task force. So first, I will call on Alan Walters to present any additional recommendations or changes from the Building and Student Services Subcommittee. Alan?
Thank you, Dr. Coleman. And I'd also like to take a moment and thank all of my teammates and subcommittee members, as well as the rest of the task force and Superintendent Spearman. This has been an eye-opening experience for us. And certainly, I know we've created a lot of relationships among ourselves that we'll continue to work together after this task is completed to make sure that we can move education forward in South Carolina. We had a few changes based on the feedback, and when you mentioned, I think 500 people, I think I spoke to all of them, seems like. But and I'm glad that they felt passionate enough about it to reach out to us and do that. One of the things we wanted to add that was brought to our attention, one of our key points was about a nurse in every school. And I think that's on page 7 in the draft report. We wanted to add a comment there, or language we proposed to add there, that there is a standard that's out there that's from the U.S. Department of Health and Human Services and the, I think it's the American Association of Pediatrics, that recommends a ratio of 1 nurse per 750 students. I know we had given some ratios in regard to counselors and other positions, and so we thought this would be a good piece of feedback to include with that to kind of give some scale to it. Another area we looked at was with the emergency drills. And we've reached out to those folks, and we're going to continue that. I know the State Department staff is as well, with the agencies who have jurisdiction over those, to see what accommodations can be made in light of the current environment. We had one word in there, I think, that was referred to relaxing standards, and that probably was not the best choice of words, because really what we want them to do is review the standards. And then we want those agencies that have jurisdiction to come back and tell us specifically what it is you expect from schools to do, that they can do in a manner that's safe, given the social distancing and other health requirements that are going to be in place. And then also we had attached as an appendix the ASHRAE report, which was quite substantial. A lot of it wasn't necessarily school specific, though some of it was. It has to do with these type of buildings in general. But so we thought, rather than just include that lengthy report in the appendix, we just made it a link in the report, so those that would like to refer to it can, but you don't have to plow through the whole thing if you don't want to. And I think that's really a lot of what we found in the feedback from this process is that nobody's going to take this report and use it as a template to go out and say, we're going to do every single one of these things. I've heard from folks who said, this idea is a great one, we're going to do it. I've heard from other folks who've looked at a different idea and said, that's not for us. And our message for both of those types of folks are, that's okay. That's the idea behind this, is to give you flexibility. Some people don't want that much flexibility. They want more specific directions, and it's like Superintendent Spearman referred to specifically with the health guidance from DHEC. So we've heard you on those as well. So I think she also had a great point that while we're hopefully going to adopt a report today, this is not the end of it. This is just maybe the beginning of the end. We're going to have to continue, because as we've constantly said throughout this process, every time we meet, every time we issue a report, it's a snapshot in time. And the conditions that are prevalent today are not necessarily the ones that are going to be in place next week or next month. So will continue to be a work in progress, and everybody's going to have to watch the conditions as closely as they can and make the best decisions possible. That being said, I hope that people will find value in this report. I think there is. We've looked at other states have looked at us, and we're all struggling to find the same answers. So I'm proud of the work that's been done, and I thank you and Superintendent Spearman for giving me the opportunity to serve. And at this time, I'd ask if any of my fellow teammates from the subcommittee, if I've left anything out or anything needs to be clarified, if they'd like to jump in.
Alan, if I could.
Yes, sir. Yes, sir. Thank you, Chuck.
Well, first of all, I've been sitting here doing the math, and you said that we've met 25 times. It feels like more than that. But it's been good work. I've been very appreciative to have been a member of the committee and to listen to and offer commentary from so many folks. So I appreciate the opportunity that we've been given, all of us, to participate in a very enlightening and informative. I would like to clarify one quick thing because this connects to some of the work that our subcommittee did related to an earlier comment from Superintendent Spearman. So Molly, I need to ask a clarification on one thing, if I could, please. I'll be the first to admit DHEC is doing a lot of work. They're working very hard to give us necessary guidance. I really appreciate that. But as you stated earlier, there are some districts around the state that have suggested that we try to impanel a group of medical professionals to add extra information, if you will, not to contradict DHEC, but to add extra comfort. Because one of the things that we've got to contend with, which we've been talking about since the beginning of this conversation, is ensuring a level of comfort for families in South Carolina that their children going back to school, they're going to be safe. It's going to be a safe environment for all that attend, whether it's the students, the teachers, or anyone else. Adding nurses is a prime example. So am I understanding from your comment earlier that the department is actually going to work to identify some folks in the medical community that can work with not only the department's leadership, but also the leadership in the various school districts around the state to answer questions and to get that extra level of comfort, if you will, as we move forward? Am I correct in understanding it that way?
I have asked this morning and to confirm a date with DHEC officials. We can discuss whether or not we need additional folks. As DHEC is the group that we turn to that are the state experts. They're epidemiologists. You know, there are many epidemiologists over the state. I personally think that like within our group, in any profession, you're going to have different folks with different opinions, but they are the group that we turn to. So the group that I have spoken with about doing this, and they have confirmed that they would be happy to, are the state epidemiologists from DHEC.
So there's no plan to bring in MUSC or Prisma or anybody.
We can talk. Yeah, we can talk about that. I don't think that DHEC officials are opposed to that, but certainly that would require, you know, they're folks with different opinions, and the people that we turn to as the state officials are those epidemiologists at DHEC. We can talk about it and see. I don't think that they would be opposed to that, but that's who I've spoken with this morning about having a meeting with the district superintendents. I'll be glad to talk with you about it.
Okay, anything we can do to offer extra information and comfort to the communities that we're serving would be greatly appreciated.
Right, and I understand that, but you know, I think again, and just from my little bit of, or from a lot, actually, it's not been a little bit, of talking with superintendents across the state who have the pleasure of having a local hospital. Not every district in the state even has a county has a hospital, But the folks that we turn to, and as I spoke to the governor this morning, right before the call, we use the epidemiologists at DHEC. They're highly qualified. They work very closely with the regional hospital folks. So I just, I want to make it as uniform as possible. And but we're happy to work with that, and we'll set up a program that will give the superintendents the information that they need.
Okay, thank you.
Thank you, Chuck. Thank you, Superintendent Spearman. Any other comments from the subcommittee members or other members of the task force? All right, Alan, thank you for those recommendations or changes to those, additions to those recommendations. Next, I will ask Patrick Kelly to present any additional recommendations or changes from the subcommittee.
Thank you, Dr. Coleman. I, like Alan, would like to echo just my thanks to my subcommittee members, Tanya, Latoya, and Sherry, to our advisory group, to the incredible staff at the State Department that worked with us throughout this process. We've read all the public comments. Like Alan, I think that there's more than, or it felt like more than Ryan counted, although I don't doubt his count. It just felt like a lot. But that's good. And based on that, we have, I think at last count, 23 revisions that we would like to offer to various portions of the report. I've got them sorted in sequential order. So if you want to walk through the report with me, I think I've got it queued up correctly. But I just want to note 3 kind of general comments off the bat that we want to be clear on based on public feedback. To clarify intent behind some of the recommendations from our subcommittee. Number 1, as Superintendent Spearman has said, as Alan said, as Chuck just alluded to, priority number 1 in all these recommendations is the safety of students and staff. So nothing in these recommendations should be read or construed to mean that there is a priority that is anything greater than the safety of students and staff. Number 2, within that, while we do want to provide as much clarity and guidance as possible to districts, we also acknowledge the fact that there is wide diversity in school facilities and resources across this state, in many cases due to inequitable funding over a period of generations. As a result, in order to reach the safest environment for every student in every district, there does need to be a level of district flexibility because not all districts are playing with the same resources and the same facilities. And so that's why you see a lot of flexible language at points. And then number 3, we just emphasize that these recommendations are guidance documents to districts in the state. We are not a legislative committee. We are not a government agency. We are offering guidance and recommendations and best practices that have been informed by incredible educators and parents and community members across the state. But ultimately, the efficacy of this task force report is incumbent on government officials to follow through on the recommendations and on the public to remain engaged in this process, because the recommendations are only as good as the follow through that comes after it. So with those 3 points offered, here are the revisions that we would suggest. First, in phase 1 of the document, under the communications portion, in number 1 that talks about local task force. Next to the word staff, we would recommend putting in parentheses the phrase including classroom teachers from multiple grade levels and content areas to clarify and emphasize that classroom teachers with experience from diverse contexts are important to local task force work. Next, under phase 1, under the HR category, we would edit the first line of number 1 to state that districts should, quote, survey staff to identify those with conditions or concerns, concerns is the new word, that could or will, and will is the new word, prevent their return. So we want to build out that recommended survey to clarify that it's not only about existing medical conditions, but also concerns that could be driving underlying medical conditions for staff. Also in phase 1, and I didn't go perfectly in order, so I'm sorry, under the state agencies category, at the very start, we would like to add a new number 1 recommendation that aligns with what Superintendent Spearman has just said. Establishment of health condition levels for schools. And it would read, in order to best guide district decision-making, the State Department should collaborate with DHEC to develop clear criteria for determining the rate of spread of COVID-19 in an area. In particular, districts need clear guidance from our public health authorities to determine which of the 3 health conditions, low, medium, or high spread, an area is in as described in the scheduling models section at the end of these recommendations. These criteria are needed by districts quickly, so this action should be a top priority for collaboration between SCDE and DHEC. So that would piggyback on what Superintendent Spearman led with in our meeting. Also in phase 1, back under communications, we would suggest revising the header for number 2 to now read establish ongoing two-way communication, ongoing being the new word, so emphasizing that this communication is an ongoing process. And then finally, under phase 1, under instruction, we would revise number 2, which talks about developing policies for distance learning options for families, to include this passage at the end. Policies that are developed should include a provision that students enrolled in magnet or special enrollment programs will not forfeit their slot as a result of opting for distance learning. So that would be in addition to the recommendations to districts to work with the School Boards Association to develop guidelines and criteria for applying for distance learning opportunities. Moving to phase 2, the summer recommendations. A couple, I'll start with state agencies and try to go in order this time. And we would like to recommend a new number 1 under state agencies. And we did send this to the full task force beforehand, but I will, for the record, read out what we've got here. The new number 1 would be entitled school funding, and it would read as follows. As the General Assembly returns in September to complete the fiscal year 2021 appropriations process, it is imperative that a per pupil increase to the EFA is carefully considered and included. An increase would not only allow the state to move closer to the FY 2020-21 estimate of the base student costs, which would be $3,164 as provided by Revenue and Fiscal Affairs, but would also help account for the increased costs districts are incurring due to added protocols and precautions in order to keep students safe. Currently, based on the weighted pupil units, the base student cost is funded by the state at $2,489 per pupil. With the undertaking of several new and necessary safety measures by districts, the General Assembly will need to strongly consider the financial impacts districts will be facing and include this increased funding to the base student cost. So that would be the new number 1 under state agencies. We would also recommend a new number 2 under state agencies. That is not new so much as it's a reminder. We heard loud and clear from the public in the feedback process that the public wants and is pushing for the State Department to seek a waiver from state testing under federal and state accountability measures for the coming school year. This task force did make that recommendation in the summer recommendations, but we'll reinforce it here. Our new number 2 will link back to the summer recommendations and reinforce the fact that this task force recommends the State Department seek a waiver from accountability testing measures in the coming school year. Also, under state agencies, a new section, which I didn't number yet, but we'll stick it in there. This one would be a new bullet entitled Waiver for Certification, Renewal, and Maintenance. And it would read as follows. Similar to the action taken during the summer of 2020, SCDE should enact a 1-year grace period for educators due for certificate renewal on June 30th, 2021. This action will enable educators and administrators to reallocate the time that would be dedicated to completing the renewal process to their continued work to meet the unique needs of students resulting from the COVID-19 pandemic. Similarly, SCDE should suspend for 1 year the SLO process for teachers on continuing contracts. This action would again increase the capacity of teachers and school-level administrators to react to the unique challenges of the coming school year. So that would be the additions under state agencies. Moving to communications in phase 2, we have 2 recommendations for 1A, which deals with calendar review by districts. We would include the following 2 passages. First, it would read as follows: given the impossibility of predicting health conditions in August, districts should exercise caution and discretion when reviewing start dates for the coming school year. Any consideration of moving up start dates should be carefully weighed against the recent increased spread of COVID-19 in our state. And we would also recommend, as an addition in that same sub-bullet, at the end for this phrase: in the event that the General Assembly appropriates the funds for the 5 leap days discussed in phase 3, school districts and local school boards should strongly consider having the scheduled first day of the 180-day school year begin later than currently scheduled. These actions may be necessary due to staff and families that may have already scheduled travel or other family commitments in alignment with the existing school calendar. So the recommendation to districts would be to push back the 180-day start to incorporate the leap days in a way that does not conflict with established plans that our families may have based on existing school calendars. The final, almost final phase 2 revision would be under human resources and finance. We would amend 2E, which deals with educator preparation. And 2E is specifically about a waiver for student teachers working with students and their capacity to do so without their coaching teacher in the room. We would add the phrase "with permission from the educator preparation program in which they are enrolled" to that requested waiver. So we would want the educator prep program to also sign off on that in addition to the State Department and districts. And then our final revision under HR in phase 2 is for number 7. This is a revision necessary based on our new number 1 about school funding and calling on the General Assembly to fully fund the base student cost. We think 7 needs to be updated if we're going to have number 1 in there. And number 7 would now read: districts should review and potentially revise their budget planning for the 2020-21 school year and build in contingencies that address funding or lack of state funding for cleaning supplies, PPE, etc. And then the new phrase is: while this task force recommends that the General Assembly fully fund education in the coming budget year, districts should continue to exercise discretion and caution, as we already had in there. So simply incorporating a passage that, while we're calling on the General Assembly to fully fund education, we still encourage districts to exercise budgetary discretion in their current budget planning process to be able to potentially account for any decrease in revenue that could occur. We didn't have anything in phase 3, which I know is going to break everybody's heart. So phase 4, we've got 2 recommendations. Under communications, number 1, we would revise the sentence that talks about districts partnering with community groups to disseminate communications about school reopening. And we would revise that sentence that starts with "these groups" to read the following: these groups could include school improvement councils, education associations, civic organizations, business advisory groups, faith-based groups, and other community partners. So simply providing guidance to districts on who to potentially partner with on the best way to disseminate communications about changes to school operations to start the new year. And then in phase 4, under human resources and finance, we would have number 1 amended, and number 1 deals with class coverage in the event of a shortage of substitute teachers in a building, and talks about encouraging districts not to engage in sprinkling of students that would lead to exceeding classroom size caps based on social distancing guidelines and things of that nature. We would include the following statement in that passage: in the event that a school has an insufficient number of substitutes, school administration should seek to protect teacher planning and collaborative times by utilizing all available staff in the building to ensure class coverage. So we would add that 1 additional statement to number 1 under human resources. And then we would have 2 revisions in the scheduling model section at the end of the recommendations. In the preamble, we want to clarify guiding principle number 2, because we heard some feedback from around the state that there was some confusion around what we meant by guiding principle number 2, and we want to clarify it because it's actually in the recommendations twice, and we want to be crystal clear. So here's what principle 2 should stay. Districts should avoid any scheduling scenario where the burden falls on a classroom teacher to simultaneously create and implement traditional and distance instruction for students during the same day. I want to be crystal clear that teachers should not be asked to be traditional and distance learning facilitator in the same day. And there was some confusion there, so hopefully that clears up the intent of that guiding principle. And then the final suggested revision in scheduling models under the traditional model, 2A, that talks about classroom arrangements. In 2A, we would strike the word classroom furniture and replace it with student desks and seating to clarify, because we heard feedback that teachers were concerned that our statement as it read meant that their filing cabinet would need to go out in the hall or something like that. That the intent of that recommendation is to make sure that classroom seating capacity does not exceed what is allowable under health guidance. So we want to be very clear there. And then our final recommendations are simply amendments to our appendices. As Superintendent Spearman mentioned at the beginning, there is new DHEC guidance on maintenance of suspected cases of COVID-19 and how districts and schools should react. So that is our new Appendix F, and that is referenced in appropriate passages now throughout the recommendations. Appendix H is now a combination of the 2 existing appendices for art instruction. We combine those together into one to streamline the tool for our arts educators and districts. Our Appendix G, that same appendix also now includes choral guidelines from national organizations that were provided by members of the public. And Appendix J, which is the guidance document from the South Carolina Association of School Librarians, has been amended and revised to include guidance from the School Librarians Association about the ways that school librarians can facilitate and equip and support teachers engaged in distance learning. So we built out that guidance further based on the Librarians Association's feedback. So that is our list of proposed revisions. I would open up to Superintendent Spearman, your comment about that the guidance include that choral students should wear masks. Yes, there are links to national organizations. And one thing with the arts guidance is we worked closely with arts organizations across the state, ABC, the Alliance for Arts, Schema. And one thing that we heard from them loud and clear is that a lot of the most important research around best practices for our art students is ongoing, whether it's about aerosols from instruments or from singing, and there are major studies in Colorado and a few other places that are in progress. So our guidance document notes that fact, and ABC has generously offered to house that document as a living document starting next week, so that it can be amended and updated as additional research and national guidance is provided beyond the scope of this task force work. And we applaud our arts educators across the state for being on top of that. South Carolina arts educators are doing exactly what needs to be done to keep our kids safe. So with that said, I would ask Latoya, Tanya, or Sherry if there's anything that was missed. We've had some great conversations, but I'd open it up to you.
Any other members of the task force? Comments for the subcommittee?
I would just say thank you, subcommittee. Thank you, Patrick, for taking the lead for us and all the advice we got from the State Department of Ed, from the other committee members. It's been a 25, I agree, seems like a small number. Didn't realize we had met that long. But again, just thank all the public who really did engage in providing feedback. I mean, they really did send in stuff, and I would say to the public that's listening to please continue to dialogue with your districts as they go forward with their plans. You know, the district level is so important that they get involved with their own district and just keep in contact with everybody. Again, thanks everybody for a great job.
Thank you, Sherry. Any other comments
Ms.
from the subcommittee?
Yes. Yes, Ms. Coleman, if I could add to
Yes.
what Sherry said and Patrick, in addition to the revisions of the recommendations based on the public comment, I do think that it will be important if we implemented some next steps in regards to it. One would be because our task force is not a state agency, if the state would take our recommendation for districts. I do believe that districts should use the checklist to complete a district plan that should be submitted to the state or either some state agency, health agency, to be approved, just so that we can ensure that the safety and instructional needs are met from our students across the state. I'm pro flexibility, and I do understand that each district, we have varying needs across the state. But I do think that just to ensure that we're all on the same page in regards to safety and meeting the needs of the instructional needs of students. In order for that to work, I know these next two things we've already included in our recommendations, but the waiver of state testing for the upcoming school year, as well as the release of essential standards, I just wanted to really reemphasize the need for districts to have that information as we adequately try to plan for. Sometimes individuals are inclined to resort back to traditional scheduling options because those structures are still in place, that the same requirements of testing and standards are still in place. And so making those decisions and releasing that information sooner rather than later, I do believe will help us to make sure that we are able to not only assess the learning needs, but actually do the right work to address the needs of students in the fall. Thank you.
Thank you, Tanya, for those comments. Any other comments from the subcommittee?
Dr. Copeland, if you are okay, I have just a couple of things really quickly that I'd like to share. One is I'm very much echo Tanya and Patrick's sentiment about state testing, but I think we also need to look at seat time and attendance. And I'm going to say that again, because, you know, if we are talking about serving students in a virtual capacity or remote capacity, the ways in which we traditionally capture seat time and attendance have to be addressed. We're not going to be able to provide hybrid school for children if we have to count them as absent if they are not physically present in our buildings. So I hope that Superintendent Spearman will be looked at very closely. Additionally, I just have to say this because I am me, and I would not be me if I didn't say it. While I very much understand the desire from the public, from parents, from educators, for specifics and for key details in this guidance, even mandates, I'd be remiss to not acknowledge that the position that we find ourselves in, which is the need to honor the unique and specific and contextual challenges of individual districts, is rooted in two very important things. One is a failure to fund the base student costs at the levels needed for many, many years. And two is our antiquated funding formula that must be looked at if we intend to address the needs of our students. I think that's what's brought us here and required the flexibility that you find in our recommendations, and that those disparities have grown among our districts over time, and they're getting wider. And so I say all of that to say this: I think there's one place we'd all agree, that we want every student in South Carolina to learn as safely and as effectively as possible. And in order for that to happen, I am hopeful that our General Assembly, when they return, will make reducing inequity in the state of South Carolina a public priority for the future of our state, of our students, and of our profession. I'm hopeful that that's going to happen. Our students deserve that. Thank you.
Thank you, LaToya, for those comments. Any other members of the task force have any questions or comments for Patrick?
Coleman, I got a real quick one, if you could.
Sure.
Over the last couple of 3 days since this document's been out, I've gotten a couple of comments and questions from some fellow school board members looking at, and the context is essentially looking at the rise of COVID cases in media where the numbers in South Carolina are going up. There's naturally an increasing concern in a number of communities as to whether we're going to have the infamous second round of COVID cases and potential closures. I have not heard anything related to that from the governor's office. So the question begs itself, if for some unfortunate reason we find ourselves having to close schools down again because of a serious surge in cases, does the State Department have a backup plan to assist with distance learning? What we would call distance learning. Do we have an LMS set up, something that can support the teachers or the school districts that need that additional support?
Dr. Coleman, I'll be glad to answer that, and thank you, Chuck. Yes, that is a valid concern, and we are in the process right now of letting an RFP to make the purchase for an repository of, there's different types of LMS, but a repository where we would be able to move into a more efficient and higher quality distance learning plan for all. That is in the works right now. We're working very closely with the Education Oversight Committee as they are accepting new districts into the pilot program, the districts that are prepared to offer e-learning, and also working to support those districts who are not quite ready to get teachers trained. We're using about half of the funding. It's approximately $21 million that the Department of Education gets from the CARES Act funding from the U.S. Department of Education. We hold back 10%. I think I've explained that before, but 10% of that funding is held at the agency. The other $194 million flows through to school districts, but we are using it about half of our funding to support getting ready, buying the LMS, the repository. We have been working with districts. Many districts already have LMS to make sure that this is a system that will work and support what's out there. But yeah, absolutely, yes, we're working on that backup plan to be better prepared. Will it be 100% in place when school starts? No, but we will be in a much better situation than we were March 16th. Also, I know that we have been encouraging those districts that did not have the devices to purchase the devices that they need through their CARES Act funding that they're receiving. We have those plans coming in now being approved. We're trying to turn those around in a day or 48 hours and get that money out to them so that they can make those purchases. One of the problems right now is that districts all across the country are doing the same thing. So there's a backup in getting the devices. But as far as are we working on being better prepared in case we would, as school districts, our schools may have to close? Yes, we are. And I believe we will be in a better shape than we were on March 16th. But I don't believe, unfortunately, that we're going to be fully there because it also includes the broadband situation. You know that the legislature is allocating, it appears that they're going to support the $20 million to purchase additional MiFis, which is the low-hanging fruit, first step in getting broadband, but all of that is in action. I've been on conversations yesterday, how that will move forward to be purchased. Our staff's working with where are the spots. We sent out an additional survey yesterday to districts asking them to help us locate the addresses of the students who are in need of better service, better broadband service. So all of that's going on. So the answer is yes. We're working on it. Will it be perfect? And 100% no, but it will be better than we were on March 16th. And I'll say also, Chuck, again, this is where in working with DHEC, I want you to know that I am having conversations with them daily. Even not so much yet about school opening because we're a month and a half away from that, but it's getting close. And I know our recommendation is 20 days prior that a decision would be made. But we are looking very, very closely now at summer school, which the intent was to open that on July 6th. I am very concerned about the spread. And we are looking now at individual communities so that we can advise those superintendent school boards on what procedure they should use for their summer school activities. So there could be some of those that will have to do it virtually rather than face-to-face. We don't want that. We know that's not as effective, but the reality is that we are having a spike in South Carolina. And I'll take this opportunity to say to the public who's on the call right now, if you want to go back to school, if you want to go to football games, if you want to cheer on your team, you need to be wearing a mask when you're out in public. It is one of the few things that we know that is effective, and folks are just not doing it like they should, and it's going to cause us not to be able to implement this plan. So I'm calling on the public to participate and really do the things that we know now are learning more and more as we go through this pandemic. But wearing a mask is effective, and we need to do that. So I'm calling on those who want to see school start and those who want to go to football games. We got to do our part. Thank you.
Thank you very much. I appreciate the time.
Thank you. Thank you, Chuck. Thank you, Superintendent Spearman. Harrison, you have a question?
Yes, Superintendent Spearman, first a comment, and that is, I certainly appreciate the awareness on your part as well as the committee's part that we need to be as flexible as possible. While I wish we could just have a checklist and say, you know, this is what everyone's going to do and this is how it's going to look, the diversity among our school districts is so broad that that's not going to fit. And just with the recent spike in cases, what's good for my school district probably is not the same as the next door school district. The other thing that I would have a question for you, Superintendent Spearman, is when we look at all of these flexible instructional models, which we have there, is the realization, as LaToya brought up, that, you know, we're going to need to see waivers in place that allow us to look at the length of you know, classroom instruction. I certainly am a proponent of as much instruction as possible, but if we do get in a situation where we're coming back and we're running buses at half capacity, we may not be able to be in school as many minutes as we traditionally are. And quite honestly, I would rather have, say, my high school students in a block that's 75 minutes per day and then be there every day than to say, well, we've got to have a 90-minute block and we're going to have them there one day and then the next day we're going to flex them virtually. I think that the face-to-face instruction is more important if possible. And so, you know, I would just ask, you know, that you give us any flexibility that we can to waive some of those specific, real narrow requirements that we normally abide by.
Thank you, Harrison. I hear you loud and clear, and I want you and all the superintendents, school board members, teachers in the state to hear me. I will be very flexible. If you need, as you're preparing for your upcoming year, send me your request as to the type waivers you need. Currently, I do have the authority granted by the General Assembly to offer additional waivers. I will do that because I agree with you. Whatever we can do to get as much face-to-face time with our students, we need to do that. And if it means a change in seat time and minutes, whatever, in order to do that in a safe way, I will be very responsive. And to the teachers and to the parents, and again, all educators and administrators, I hear you on the testing assessment. I'm going to be looking at that very, very closely. When the report is completed, I'll be reading, contemplating, and announcing plans as we go forth. I'm not prepared to do all of that today, but I want you to know that I have sentiments. I hear you, and I want to do anything that we can to make school a safe place and take away as much anxiety as we can as we go forward. So I'm not prepared to make all announcements on that today, but please know that I hear you and I am very, very sympathetic to what you're saying, and I understand that. So we'll be looking at all of the recommendations, and as we go forward in the next few weeks, be open to waiver request approval and also other things that would go forth for the upcoming school year.
And one last comment on that, Superintendent Spearman, I would want to encourage my peers, superintendents. I think you know my background in the arts, and then, I don't want to see us to cut time out of the day at the expense of the arts, physical education, and those type activities, because those are an integral part of school. And I just want to go on record that I encourage my peers not to make any cuts and changes in their schedule at the expense of those programs.
Well, thank you. And I agree with you. I'm a music teacher as well, and I know how important these programs are to all our students, not just in content, but in their social and emotional well-being. I will say, though, I was shocked when Dr. Duvay, who is one of the new epidemiologists at DHEC, in a call just this week, she cautioned us. She said her daughter is an opera singer and that we need to be extremely careful in our choral programs, band, because the spread can happen so quickly with just one student. It can infect an entire classroom if they are singing properly and projecting. So I appreciate, Patrick, your committee working with the arts group. So there's so much to consider here. And again, my challenge and one of my concerns is because I've been hearing some of the talk. I've been hearing some of the talk from some districts who say, we're gonna operate as normal back just like we did. No, you can't do that. You can't do that. And while I do have some authority here, and you all do too, and working hard, now the next move is down to the district level, where district officials, school board members, superintendents, principals have got to take this very seriously and do the best they can with implementing this for their community. I mentioned this to Dr. Traxler and her team just today. They have to understand that in some communities, yes, a county like Greenville, you may look at the spread there and need to look at it community-wise because there's so many different high schools, so many different feeder systems. In my county, there's one feeder system. If it's in our county, we don't worry whether it's on the north side or south side because all those children are coming to one school, which makes it very, very different. I see Sherry nodding. Wando, with your 4,000 children there coming from an area, but Charleston's so large, you've got many areas, a long, narrow district where you may close one area and not have to close the other. So again, it's very unique. And I think that's, again, why the DHEC officials have been very slow to give us a rubric that everybody will look at in the same way, because it is different in every community. And that's why they're very slow to say, use this, it will work for everybody, because there are some nuances there.
Thank you, Superintendent Spearman and Harrison, for those comments. Any other comments before we move to Scott?
Dr. Coleman, if I may, I failed, I mentioned it in our chat box here, but in talking, Chuck Sailors and I were talking about this panel, this meeting that we want to have with DHEC officials, health experts, with our school superintendents. We are planning that in conjunction with the superintendent's division at SCASA. They too understand the need for this, and department's working very closely with them. It's not just a department meeting, but would be one that's done in conjunction with the superintendent's division.
Great, thank you for that. Next, Scott Turner, present any additional recommendations or changes from the operations subcommittee.
Thank you, Dr. Coleman. Thank you, Molly, for giving us the opportunity, and also thanks to Missy and Sherry and Brian. As I read through the comments from the different associations and community groups and just public comments was just, especially the public comments, was the continuum of opinions and thoughts regarding returning to school. And just the, you have both extremes, those who want us to remain closed, those who want us to be fully open and operational as if nothing has changed. And so that makes it extremely difficult for district leaders to make decisions when we're all trying to, I think we all want to educate students face to face, but facing the realities of our current situation. I do have some observations, not necessarily recommendations to change the language of the document. First was, and most of them have been mentioned, but I just want to reiterate a few. Here, the districts really wanted stronger directives rather than guidance. And it's, you know, I've talked to other people, and it's probably the first that they want you to want to do rather than having flexibility. But that also goes along with fully funding the base student cost. We have heard from legislative delegation members asking us to be fully open and operational. And if they intend for us to do that, they really need to look at that funding the full base student cost. The second observation is that we would ask the State Department of Education should provide templates for all proposed communications and other related items, so districts will not have to recreate any materials. We realize that not all districts have the capacity and staff in order to create all the documents and protocols and trainings that are needed to take place. And so we're asking the department to do as much as possible to create those documents so they can be used as a template for each district under each of the scenarios that have been laid out in this report. The third observation is the paradox or the Gordian knot we find ourselves in as we face the question of full face-to-face instruction, while DHEC is continuing to say that we need to follow social distancing guidelines in classrooms that do not all have desks, but many of them have tables now. Students sit around tables rather than sitting at desk. And also the continued guidelines of buses operating at 50% capacity. This really places districts in an untenable position. That is the crux of the problem, is as we look at those guidelines and we're being asked to return to normal, how does that happen? I don't have the answer to that question, but many people feel uncomfortable saying we're going to have fully open functioning schools when DHEC is saying, and I agree with what they're saying, that we have to maintain social distancing in a classroom and on a school bus. The fourth observation is that our medical leaders, DHEC, if that's who you're deferring to, must define the levels of community spread so district leaders can make those decisions based on what's happening in their communities and their schools. The fifth observation, there appears to be some level of disconnect between those wanting all students in school versus the realistic concerns that we are hearing from our teachers and other work groups regarding health risk and their return to school. There's a major disconnect between parents wanting their children in school and realizing or not realizing that we are dealing with employees who may be in high-risk health groups who have valid fears and concerns regarding returning to a classroom or a workspace and being exposed. Again, that is putting districts in a position of want everyone to be safe. We want children to be safe, but we also want to protect our employees. That again is just an observation. I don't have the answer to that, but I think it is a growing divide among the public sentiment versus what we're hearing internally from our own employees. And we need to be able to address that. The last one is that districts cannot afford to fund dual systems in an effort to appease all scenarios. We simply cannot afford to run two separate systems at the same time. We don't have the staff or the employees to do that. So I will open it up to the other members of my subcommittee if they have any other recommendations or comments on that.
Thank you. Thank you, Scott. Any other members of the subcommittee like to comment?
I would echo exactly what Dr. Turner is saying. The funding piece is most important. However, the paradox to what he referred is just true. It's out there. I've got employees now that have health concerns about coming back to school and haven't been in the building since the March 13th. And then I have those that are coming in every day, and it's questions from my teachers. You know, is there a plan? I can't come back to school if I can do distance learning. And again, I would echo everything Dr. Turner said. And I'd like to take this opportunity to thank the members of my subcommittee as well as those others in the other two subcommittees who have worked so hard on this document. Thank you.
Thanks, Sherry. Any other comment?
Dr. Coleman.
Yes.
I'd like just to make a comment.
Yes, Superintendent Spearman, sure.
First of all, in no way, and I don't believe Dr. Turner was doing this, but in no way, I want to thank DHEC. In fact, I hear lots of complaints, and I'll say this over again. I hear lots of complaints about the guidance that DHEC has given us on school buses. But I will be the first, and I've said this several times, they have been the most lenient of any state health agency in the nation, and we need to recognize that. Originally, the number on the bus was going to be 9 to 11 students. And after working with our engineers, our school bus transportation office, Dr. Traxler and her team going on the bus, they actually came out to get on the bus to look at the situation, that they have raised that guidance now to where we'll be able to get anywhere approximately 50%, 46 to 50%. I know it's still difficult, but you know, it's a reality and we got to live with it and we got to figure out a way to make it work. I am happy to give waivers to districts as if there's a way that they can need some variance on seat time. As I mentioned earlier, I'm very happy to do that. And I think, you know, it is a challenge, but I in no way want to say anything to ridicule DHEC for the guidance that they have given us. Now they're working, I want them to, you know, be quicker, and they're working on giving us additional guidance on the protocols as we move through the medium, low, high situations. And then the other thing is, I want us to be careful. While I understand what our folks are saying about base student cost, we also, I want to recognize that the General Assembly is about to fund us $227 million that will not be in the base student cost, but it will be going straight out to school districts, as well as additional funding. So we love to talk about base student costs. I agree with that, but it scares me sometimes because we don't give the credit where there's other funding. The teacher pay raise last year wasn't put in base student costs. It was sent down in a line item. So we got to be very, very careful. I don't want to, I'm all for everything being funding, asking for more funding. I do it every year, ask for more funding and spokesperson. But I want this task force to recognize that on Tuesday, there's going to be several $100 million funded for this cause. In addition, school districts are also getting $194 million for this cause. that is not going to be in the base student cost. So that's just a caution that as we look at this, surely we need to give that credit that that's what, 300, almost $400 million right there, that in those two funds that will be coming to school districts for these operations, but not in the base, what we normally talk about as in the base student cost. So we don't need to forget that. Thank you, Dr. Coleman.
Thank you, Superintendent Spearman. That's an excellent point. Any other comments from the subcommittee or members of the task force on Scott's comments?
Dr. Coleman, I'd like to make a comment, please.
Yes.
I just want to echo Dr. Turner's comments and just appreciate his leadership on our operations and admin subcommittee. And just again, I think that the thing that stands out to me is we are trying to implement multiple models and multiple options for our families. And, funding is difficult at best, but when you start trying to be all things to all people, that can get very expensive. And, as I've talked to other districts, the CARES Act funding or the ESSER funding, it was already going to be placed in situations where they were just trying to address budget gaps going into the fall and just trying to hold on to staff. So again, the more we talk about multiple options and multiple models, that gets expensive. And those funds are short, and it's sort of like supply and demand. Again, the transportation, we've talked about that. The seat times and the transportation go hand in hand. If we're going to try to have a traditional model, it's difficult to do that with the funding for transportation. So again, just underscoring everything he said, knowing that it's, we're trying to take a little bit and make it go a long way, but I would be remiss if I didn't make those comments.
Thank you, Missy. All right. Any other task force or questions for Scott?
Dr. Coleman, like you say, just real quick, I know it does feel like an athletic analogy. We feel like we're playing in the second quarter and we're trying to still write the playbook sometimes. But, I appreciate everybody's patience. I know the department's working hard. I know we're all working hard. There's educators across the state that are every day in the school building right now, making sure these classrooms are ready and making sure curriculum is set. So I think I appreciate patience more than anything from the public, because we're getting questions and we're trying to find the answers. But I can tell you, we have a great group of educators in South Carolina. We have a wonderful task force here that are working hard, that have been meeting since April to make sure these schools are safe, to make sure the academic setting is ready for all students to come back in August in whatever fashion that is. And I just say I appreciate the committee and the work they've done, and the State Department for the support. Anytime I've reached out, we've gotten that support. So I just want us to understand patience is a good thing. Trust the leaders that we have, and I guarantee you, when kids come back, whenever they come back in whatever fashion, they're going to be healthy, they're going to be safe, and they're going to be smarter today than they were yesterday. And I think we just got to remember that.
Thank you, Brian. Those are excellent comments. Next on the agenda, Superintendent Spearman has asked us to present this plan and these recommendations for the school year to her, given the need for these recommendations to be final in order for her to consider them and for our districts, as we've all said, to plan. I'd like to ask for a consensus among our task force members to adopt these additions and changes as part of our recommendations. And if there are any objections to that, I will certainly note them. But if there's any objections, I'd like to recommend that we do present these recommendations with these changes to Superintendent Spearman. And we, as we know, we will, there will still be continuing work on this. I think it's important that that we move forward so that our districts can plan and have this framework to work with. All right. Thank you very, very much, members of the task force. It's been a long process, but again, I want to thank you for your very hard work. I do want to mention that We will be having an executive summary, and also that we put together, make it executive summary of our recommendations, because they are rather lengthy. Also, on Monday at 2:30, there'll be a press conference at the USC Alumni Center Grand Ballroom on the first floor. We invite any members of the task force or advisory groups to attend. Face masks will be provided, and will be provided social distancing. So I just want to let everybody know about that on Monday at 2:30. Before we end, I would like, if there's any other closing comments from members of their task force before I close, I certainly appreciate that.
Dr. Coleman, is it okay if I say something?
Mm-hmm.
I know I just read a blanket list of revisions, but I just love to share one thought beyond revisions. I just want to emphasize how grateful I am for the work of this committee, how much I've learned from this incredible group. I also want to commend the staff at the State Department for the tireless work that they have put in supporting this task force. The ones that are on this call, Ryan and Dr. Mathis, Dr. Payne, Katie, Lori, Virgie, like they have gone above and beyond to support the work of this task force, and it is greatly appreciated. I also am grateful for the heavy engagement of the people across South Carolina, parents and guardians, families and educators, community members. Our state has shown that it cares about education. And in that engagement, as several people have pointed out in reading through the feedback, it's obvious there are disagreements in our state, whether we should have extra days or not, whether we should go back or not, whether we should wear masks or not. And just debate and discussion is healthy. I'm a government teacher, so I love civic discourse and democracy in action. And regardless of whether I agreed with specific feedback, I knew the intention behind the engagement was aligned to the same goal, to ensure the best, safest learning and work environment for our students and staff. These are hard questions that we've wrestled with, and it's unlikely we'll ever reach 100% agreement. But there's one area that I hope as we wrap up our work as a task force that we as a state can reach 100% consensus on. Because there were two email, I read all the email comments that Ryan provided. There were two that struck me. I just want to kind of point them out. One said, I vote that things go back to the way they were pre-COVID-19. And the other said, our children need to return to school in August just as they left it back in March. There's no tolerance for a new normal. Now, look, I'm a teacher and I'm a parent. I'm ready to get back. I'm ready to work with students. I'm ready for my kids to be back with their friends and their incredible teachers. And I know that's exactly what those public comments wanted. They want to get our kids back to what we know they need. But I hope that we can all reject as a state any resistance to a new normal and a desire to go back to the old normal. And why? Two reasons. Number one, we're not in a pre-COVID-19 world anymore. We don't get to vote this thing out of existence. It's here. And if anything, we're deeper into the COVID-19 world than we were on March 13th. And Dr. Bell made that crystal clear yesterday when she said that every day that we don't all do our part, we are extending the duration of this pandemic. So I applaud Superintendent Spearman for coming out strongly on that point. And as much as I want to go back to normal, we're delaying our capacity to get there with every moment as a community that we fail to heed the wisdom of our public health officials. We don't get to decide when we're in post-COVID-19, but we do get to decide if we're going to take the collective actions to move more quickly toward that world. That means that everybody has to do their part. And it means we're going to have to sacrifice some personal comforts and preferred routines. I don't want to do it, but I know it's necessary, and I know it because of where I grew up. So I'm a history teacher. So here's a quick history lesson. I grew up in Oak Ridge, Tennessee, which is where the atomic bomb was developed during World War II, which meant the town that I grew up in was at the top, right after Washington, D.C., of the Soviet target list in the Cold War. So what did my mom have to do when she was in school as a child? There are air raid sirens in my hometown, and she would have to do air raid drills where kids got under their desk while the sirens blared because of the Cold War, because the community came together and sacrificed their preference and their comforts to fight a common enemy. I still had the air raid drills when I was little. We didn't have to get under desks anymore. I guess we got wiser that doesn't really do any good in the event of a war, but we still had that. And did I want that as a child? Heck no, it was scary to hear those sirens. But my teachers and my parents modeled for me that that's what we had to do as a community to fight a common enemy. And that's what we have to do with this virus. So I don't care about the dichotomies of I want to wear a mask or not, I want to socially distance or not, I want to reduce large gatherings at school or not. The only dichotomy we've got in front of us is the choice of do we want to open schools or not? And if we don't all take the steps we need to right now, the answer is we will not be able to open schools. The other reason why I know this is true is because this mentality that I don't have a tolerance for a new normal goes beyond COVID-19 to a deeper truth that Dr. Dixon has so wonderfully stated throughout this task force work. And that's the simple truth. The old normal wasn't what was best for too many kids in South Carolina. When this crisis eventually passes, and it will, we will have missed a golden opportunity as a state if we settle back into our old norms. Because those old norms included underfunded schools, allowing gross inequities in resources, especially for our kids with the least, and failing to adequately value and support our professional educators and other critical public servants like mental health professionals, public health professionals, and social workers that our kids need and rely on every day. And in spite of these actions, our undervaluing of education in our old normal, our kids have still accomplished remarkable things in this state. But that's not because of what we've done, it's in spite of what we've done. It's not because of the old normal, it's in spite of the old normal. And our students have thrived while teachers have done more with less. So I have no interest in going back to the old normal, and I hope that no one else in this state does either. I want a new normal where we invest in our education system as if we are investing in our future. A system where we're going to care more about measuring lives changed and dreams realized than we care about measuring compliance and numbers. So I want us to pursue that new normal with the same mentality that I had as a parent on my worst day as a parent, which is my youngest broke her arm. She shattered it a few years ago. I'm not a doctor, but I didn't need the x-ray machine. That arm was real broke. And we headed straight to the emergency room. And when we got there, I listened to the experts. I listened to the doctors because they knew what my daughter needed. And in that moment, once they had stabilized her, I was willing as a parent to do whatever it took to get my daughter whole again. This pandemic is an x-ray machine. Just as the x-ray machine showed that my daughter's arm is broken, it has shown that our systems have fractures and breaks in them that are not sustainable. And it is up to us now to dedicate ourselves, just as a parent will do when their child is in distress. We got to dedicate ourselves to fixing those breaks and fractures, not by going back to an old normal, but creating a new one where we provide the education that every kid in this state deserves. So again, thank you to everybody on this task force. I have loved learning with you, and I am excited to see what comes next as we work toward a better system for all our kids.
Thank you, Patrick. It's a very, very eloquent comment. Certainly appreciate that. Superintendent Spearman, do you have any closing comments?
Thank you, Dr. Coleman. I appreciate all of you, the time you've given. Patrick, thank you for your eloquent plea. There's really nothing else that needs to be said. I think he covered it. And again, my commitment is to listen and act upon your recommendations, and we will be formulating all of that for our announcements as we go forward in the next few days and weeks. So thank you so much for your work, and it will not go without action. That's my responsibility now, to take your recommendations and turn them into action, working with the local school districts, superintendents, and their boards. So look forward to all of that and appreciate your service.
Thank you, Superintendent Spearman. And I would like to say just on a personal note, when Superintendent Spearman asked me to lead this group, I went home, thought about it, hesitated for a few minutes, went home and thought about it, prayed about it. And, I really realized that, our children are the state's most precious resource, and will sustain us and as a productive society. So yeah, I gladly accepted, and I just want to say that I'm a much better person for having worked with these outstanding professionals, and I've been honored to work with so many dedicated people to support our students, our faculty, our staff, our parents, our communities, and our education system. I also just want to thank personally my staff at Sand Hill for allowing me to spend a lot of time working on this and taking care of things at Sandhill and my colleagues at Clemson also. And so if there are no further comments, we will we'll adjourn our meeting of this task force. And again, thank you to everyone.
Thank you.